Live from UBC studios in Kampala. This is Good Morning Uganda Extra.
Welcome back from that commercial break. We are back with Good Morning Uganda Extra, and once again I'm Robert Chirabonyo. In case you've just joined, we are here every weekday with relative information in the world of politics, health, which now we are moving into, and today we are going to be discussing diabetes. Well, according to the International Diabetes Federation, about 425 million people are living with diabetes globally. And when it comes to Uganda, we may not have the actual figures, but also it is about a million plus Ugandans that are having diabetes. And with me this morning in studios, I have Dr. Lubega Martin, a person who has taken so much effort in studying, understanding, and creating awareness when it comes to diabetes, which is a disease that many Ugandans have succumbed to it due to scarcity or lack of information on how best to detect and manage this disease. Doctor, you're most welcome to our studios this morning.
Good morning, Robert. It's nice being here. Yeah.
Well, to start with, even before we go in the in-depth of the disease, what prompted you to be so passionate? What is your life story about that brought you? There are many fields, but why did you particularly give more emphasis to diabetes?
For starters, you introduced me as a doctor, but I'm a nurse. I'm a graduate nurse from Makerere University. And as a nurse, I'm trained to, I'm a general practitioner.
Okay.
So being a general practitioner, that means that I have studied all these various conditions. So it's upon me to choose what I prioritize. So I've previously written about pregnancy because of its demand in society and the many maternal deaths that we are having as a country. But when I looked at the rise in the non-communicable diseases, I thought I have to give a push to diabetes because it is currently a disease that is on a rise, and it has not been given the attention in many of our healthcare settings.
Well, reading a number of your literature, one can hardly assume he's talking to a doctor, but all the same, you're in the medical fraternity. I've come across a few of your books, and really you're passionate when you're writing about these issues of health. Let's begin with the diabetes. This is something that many Ugandans could be having, but they are not aware.
Yeah.
When you talk about, it's a non-communicable disease first and foremost, which sometimes also doesn't give the medical fraternity. You know, we are more so on pandemics, easily transmitted diseases, but non-communicable diseases, we find that we've not given them so much of effort, maybe because we believe they're not passed on.
Maybe because of that, but the issue is basically because of the trends. Previously, globally, including our country, we've been battling so much with communicable diseases. Diseases like malaria, HIV, and those diseases that are communicable. But now, as we are trying to manage the other ones, now the non-communicable diseases are coming in. Cancer, hypertension, diabetes, and others are now setting in. Now, it now demands us that we give them attention. That's why I thought it's wise that I do something for diabetes. Yeah.
And this brings me to, what is diabetes? Help the public better understand this.
So diabetes is a non-communicable disease. When I say non-communicable disease, I'm meaning that it's a disease that is non-transmitted from one person to another. It's not that it's not like malaria, that a mosquito is going to come when it stings me with my malaria, it is also going to spread to you. It's not like HIV, it's not like COVID-19, that when I have COVID I can actually spread to you. It's a disease that when you have, it's non-communicable. You will have it as an individual. So it is a non-communicable disease, basically associated with high blood levels, high blood sugar levels. So someone has high blood sugar levels and it is a chronic disease. Chronic meaning that when you get it, chances are more that you will stay with it. The most of the chances are that you're going to stay with it for the rest of your life. So it also means that it needs attention. It needs the patient needs to better understand it, because they are going to live with it for the rest
And
of
better
their
know how
time.
to manage it.
Yes, it's not like malaria that you're going to go take some pills, take some injections and you get fine.
Cures.
Yes, it will certainly take some longer time.
Help us understand. Many a times I've gone to health facilities, either, you know, we live in extended families, taking a relative and then they'll tell you, this is diabetes type, this diabetes. Help us also understand the various types.
So as I said, diabetes is a chronic disease. It's a disease associated with dysfunction of the insulin hormone. Insulin is a hormone in our bodies that is responsible for regulation of blood sugars. Blood sugars result from the food we eat. So when you eat food, your body automatically has to, normally is supposed to produce this hormone called insulin so that it can help your body control the blood sugars. So in case you have a problem with either the production or the effect or the reaction of your body tissues to this insulin, then you are going to get diabetes. Now you asked me about the types. We have type 1 diabetes. We also have type 2 diabetes. Now type 1 diabetes is a bit rare. It's more in the children, though it's also on a rise. We are seeing it more, the prevalence is increasing, but it's diagnosed more specifically among the children, among children and early adults below the age of 35. And it's basically associated with the inability of the pancreas to produce insulin, that insulin hormone that is supposed to regulate the blood sugars. Then with type 2, it is a disease that is coming. It can also come because of the production issues, but in most cases it is associated with maybe the cells, your body tissues are no longer sensitive to the insulin that is being produced. So you find that the insulin is at times produced, you have enough insulin in your body, but our muscles, because when insulin is produced, it takes away this blood sugar by stimulating your blood muscles to absorb it and store it. Because sugar is not supposed to be in blood, but the body needs it, so it is stored in the body muscles. So you find that in type 2, that's where we are going to find such situations. And it is more common among the elderly, among the middle age and the elderly. And of course, it's the most common type. Yes. So that's why most of the public knew that, most of them know that diabetes is a disease of the old people. But as I've told you, we have now seen the trends of type 1 also doing what? Also increasing.
Let's look at how best we can diagnose this, because most of the times doctors tell us that maybe this was treatable, or death could have been avoidable if it was earlier detected or detected a bit early. So how do we diagnose diabetes? How does a person get to know so that we avoid death as a result of delayed diagnosis and also treatment?
So actually, for starters, it is very important for someone to know what are the risk factors of diabetes. What are the things that are going to predispose you? What are the things that should make you worried that you may have diabetes? One, if you have a family where one of the relatives, the first line relative, that is mother, your father, your siblings, if any one of those has diabetes, it's likely that you can also get it. If you are into smoking, if you're into alcoholism, if you take a lot of alcohol, if you don't exercise, all those are factors that can predispose you to diabetes. And so what are the symptoms? Because before you go to the hospital, you're going to first see some symptoms. So you're going to see symptoms like feeling so thirsty again and again. Even when you take water, you feel like you need more and more water. So that is one symptom, feeling thirsty. And then the frequency of urination. You want to urinate again and again. You go, after 5 minutes you want to go, you get? That is frequenting urination. Then some people get itching of the skin. you feel like the skin is ever itching, you don't have any allergies, you don't have any problem, any other problem that will result into itching, but that is also a symptom. So when you get such symptoms, it demands that you go to a facility, you go to a health care provider who is actually going to help you to screen. The other symptom may also be unexplainable loss of weight. For example, if you may be jailed, you can lose weight because of the stress there. If maybe you've been ill of other illnesses, you can lose some weight. But there is this unexplainable loss of weight. You become thin and you don't understand why you're
losing weight.
Yeah, why you're losing weight. So all these are symptoms that should ignite someone to go to a health care provider to seek screening. So when you go to the facility, there are various modes of screening and diagnosing diabetes. But the most common one, we use a glucometer, and it's called the random blood sugar test. So the random blood sugar test is, for example, if you walked from here and you entered into any health facility, they will get a glucometer, they will ask you when did you last eat, you tell them when you last ate, and they will pick a sample. The glucometer will be in position to give us a figure of the state of the sugar. So when it is on that, just that random blood sugar, it is if it's above 11 millimoles, it may make us to suspect that you have diabetes, and it becomes more serious if you have the other symptoms. You get, because at times you may have just eaten and the blood sugars are still high. But if you have the other symptoms, it may worry us. Then in some other areas, in facilities that have these services, they can do what we call a fasting. They give you an oral glucose, you drink, then they give you time to rest for 2 hours, then they do a test. So they will also depend on the results that will come out of that result of that test to tell us whether you have diabetes or not.
That brings me to a question. Then how can we live healthy? A patient of diabetes, how can they live healthy? Because most of the times you hear the medical term to use, but maybe you're at a party or you're called, there's kind of like an emergency, and said maybe he didn't manage himself well, she didn't manage herself well.
So when someone has been diagnosed of diabetes, it is not actually an easy thing. I've worked closely with these patients in Wakiso, in Kalisizo, and I've seen that it's not an easy state when someone has just been told that you have diabetes, because they know they are going to live with this disease for the rest of their life. So it needs someone to, one, accept that now I have diabetes. When you accept that you have diabetes, you're going to be in position to know how you're going to manage it. You're going to be in position to adhere to the medications. Because if you don't adhere to the medications, if you don't adhere to the health teaching that you've been given, then it means that you're going to tend into complications. And actually what makes diabetes hard are the complications. But I've actually recently, I met one of the senior officials in this country who told me that he has lived for 30 years with diabetes without any medication. And that is because we know that as health workers, we know that the first line treatment for diabetes is physical exercise and the diet. If you're in position to control your to control your diet and make sure you eat healthy, you get the diabetic meal, you go away from alcohol, you go away from the junk, because we said that this blood sugar is coming from what we eat. So if you're in position to control what you eat, even after you've been diagnosed, you're going to be in position to control your blood sugars, because the main goal in the management of diabetes is to make sure that now your blood sugars are within control. They are not tending to they are not bringing in complications, as we are going to see later. So our diabetic patient needs to have health education. When you go in many of our facilities, most especially the government facilities, you realize that they have formulated what we call patient clubs. Even some of these facilities here, the likes of Mengo, they have these patient clubs. So a patient club, you meet and they are going to talk to you as patients. You will have a health worker who is going to talk to you and give you health education on physical exercise, on what you're supposed to eat, on the medication, and what you're supposed to do in times of crisis. So, as I said, it's a chronic disease. The patient must be empowered to do everything that they need to do so that they don't get into crisis. So, with the diabetic meal, you need to make sure that if you have a plate, if you're serving a plate of food, half of that plate is greens and vegetables. We know the greens, we know the cabbages, we know the sukuma wiki, we know the cucumber, we know the fruits, we know the bananas, we know watermelons, we know pineapples. Those are it should make half of your plate. Why? Those things have little sugar, and they have natural sugar. They have natural sugar which the body can handle. But if you go to you go to these restaurants, you are looking for burgers.
It's a buffet, so everything comes.
Everything comes.
You're looking for everything. So well, Martin, there's so much we can discuss, but unfortunately, time is not so much on our side. I know we'll have you later, of course, for something more regarding this. But what are your final shots when it comes to managing this disease, detection and prevention?
One, I would really want to appreciate that government has done what it can do for the patients that have been currently there. That means that when you go to many of our public facilities, because why am I talking about looking at public facilities? This is where we should be in control of these public facilities as the citizens of our country. This is our money, this is our tax. So our government has been in position to put their testing services. It has been in position to put their screening services, but even the medications. But with the increase in the number of people that are getting this disease, you realize that these things are no longer enough. So I've also written this handbook because I understand that health education is very important. I've written this handbook to make sure that it eases the health education of the patients. Even the health workers that are working with these patients, it makes it very easy for them. It's a simple handbook, as anyone can see. It's very colored, so someone can actually read. It's simple non-medical English. I put it in simple non-medical English. It is called Living with Diabetes, a Healthy Perspective. So I'm trying to give a health perspective to someone who is living with diabetes. You have diabetes, you want to know how can I live with diabetes without getting the complications, because we have complications like people have lost their they have become blind, people have lost their vision, people have gotten diabetic foot, where someone gets a simple wound on the foot and
develops forever.
Actually,
it becomes a serious wound. That when you have diabetes and you get a wound, that is the outcome. Automatically
you get amputated.
You have to be
so we understand that because the sugars are many in the body, it makes wound healing very hard. So some of our patients don't know these things. You find he's diabetic, but he's walking barefooted on the ground. The ground may have sharps, may have nails, and these may actually do what? Cause a cut that can result into a serious wound if not well managed, even to amputation. So these are things patients need to know. These are things that patients need to know, and if they know them, we are sure they are going to be in position to manage themselves very well. Diabetes is all about self-care. Yes, we give these medications, but self-care becomes very important. How you do your exercise, how you control what you eat, it becomes very important.
Martin, but there's also something very important. I really feel a person watching us, and maybe they have a patient or themselves are diabetic, are managing emergencies, these complications that crop up. What information do they need, maybe the family and the patient themselves, when these moments strike?
When we talk about managing emergencies, it's very important that I talk about at least one or two emergencies so that the public knows what are the emergencies someone with diabetes can actually get. One of the emergencies is hypoglycemia. Hypoglycemia is a state when the body does not have enough sugars. What does that mean? It means that probably this patient did not eat at all. Because, and that happens most commonly with patients who have just been diagnosed. They fear to take the what? They fear to eat food because they have told them when you eat a lot, your sugars will go up. So they tend to avoid eating. And now they are avoiding eating, but they are taking the medication. Remember, the medication you're taking is trying to play around with your insulin to make sure that it can remove the sugars. So you've not eaten, you've taken the medication, the sugars are all depleted from the body. So what does it end in? What does it result in? You get low sugars, it results into hypoglycemia, and someone may faint. So that's where you find that someone has fainted, a diabetic patient has fainted. So what can we do, for example, in that state? Patients need to know how they take their medications and when they need to take their medications. These are things that we talk about when our patients come for health education in our facilities. So I encourage patients to adhere to this advice. If they tell you take the medication, because it's not that we just tell you. Actually, we are supposed to sit with you and we make a plan. Because the plan for you who comes here in the studio in the morning is not the same plan like that I'm going to give to a lorry driver that is driving Uganda to Congo. You get? I have to look at your work, I have to look at your schedule of the day, and I see which type of medication for starters. The other cause of those emergencies is people self-medicating. Because they have my mother had diabetes and she was taking this type of medication, then when she's also diagnosed, she just wants to pick from there without going to the health worker. So you realize that because our bodies are different, because our blood sugars may not be the same, and our modes of life are different, we cannot be taking the same medications. So you will find that we have patients with diabetes in a group, but each one is taking a different type of medication. And that different type of medication is specifically given after a critical analysis. After a critical analysis of the patient's condition, of the patient's state. It's not just from the blue. So we advise patients to adhere to the treatment plan, to eat when they are supposed to eat, and they should not eat a lot of junk, a lot of refined foods. Those refined foods, when you're sugar, some people have even been advised to leave sugar because that is refined sugar. We have natural sugar in sugar canes, in sweet bananas. You are encouraged to eat that. However, of recent, nutritionists and pharmacists have realized that some people cannot do away with sugar. So they have developed sugar for diabetic patients. But if you cannot access it, because I understand that the other challenge we are having in diabetes management in the country is that many of our patients are not in position to access the medications. Those some who can access are not in position to afford it. You get? That's why I would still remind our parliamentarians. Actually, Parliament in October, around 12th October, they passed a motion that is urging government to increase its investment in the medications for non-communicable diseases like diabetes. So that patients are in position to access it and afford it. You get? Because if a patient does not afford the medication, it means they are going to get into complications. These complications are actually what killed these patients with diabetes. Diabetes itself is manageable, but you are going to get complications that may result into your death. So we advise patients to adhere to their medications, adhere to the feeding plan that was developed with your health care provider. Make sure you have physical exercise. When you talk about physical exercise, we are not telling that you run
the entire village.
No, some physical exercise can even be done in your house. Some it's as easy as taking a walk. You take a walk. That's at least 30 minutes of physical exercise in a day. Anyway, you had asked me about emergencies. The other one is hyperglycemia. Hyperglycemia, for example, you talked about a situation of you at a party and someone blacks out or gets into issues. Now, what brings hyperglycemia? Hypo is you have low blood sugars. Hyper, it means that the blood sugars have gone high. Now, that means that this person either didn't take their medication or they took their medication late or not in the timing that was planned, or they have eaten a lot of carbohydrate. We have three major types of food. We have carbohydrates, proteins, and vitamins and vegetables. So we know that carbohydrates are the major source of blood sugars. When you eat a lot of them, they can shoot your blood sugars. We know that things like alcohol, they have a very high concentration of calories, and these are the calories that contribute to your blood sugar. So if you are diabetic, you go to a bar with friends and you drink, expect the blood sugars to do what? To go high. So to avoid that, to be prepared for these emergencies, it is very important that even the people around you know what you're supposed to do. So that if you're walking with friends, don't hide with your friends, your people that you're always moving with. Don't hide them the fact that you have what? Diabetes. They should know. So that when they see you getting out of control, maybe you're taking alcohol yet you're not supposed to take it, they can control you. They know what to do. For example, when you get into hyperglycemia, for example, you may have your medication, you have your insulin. They should be in position to know, at least the people, your close people, they should know how to administer this insulin to you. So my advice to patients that have diabetes, don't keep it as a secret. Make sure that the people that you live with, your wife, your husband, your children, your helpers at home, they know what they should be in position to intervene in case you get in case you get into a crisis. Then the other thing is to drink water. People with diabetes need to drink a lot of water. Then basically that.
Well, Martin, we've talked so much on personal. That is personal prevention measures, personal management measures of diabetes. But let's look at also cost of treatment.
Now, the cost of treatment, actually the cost of treatment is high for diabetes. It is still high for many Ugandans. And you know, previously people thought that diabetes is a disease of the rich.
Yes.
You get? But I want to be here and tell the public openly, whether you're poor, whether you're educated, whether you're non-educated, you can get diabetes. Whether you're old, whether you're young, if you don't control what you eat, if you don't exercise, if you continue with alcohol, if you're smoking, your chances of getting diabetes are high. So there's nothing like it's a disease for the rich. So if you get the disease yet you're poor, you're not in position to afford it, like actually majority of the Ugandans are not in position to afford medications for diabetes. I will give you an example. We have common drugs. I'll talk about a drug like metformin. They are brands, of course, but you'll find that maybe the cheapest brand, the cheapest you're going to get on market, may be around 500. And this is a tablet that a patient has to take on a daily basis. How many Ugandans can afford to pay 500 for a tablet? You get? And now this comes to government now. And I think that's why Parliament was forced to pass that motion to urge government to increase facilitation funding for this. Because we always have stockouts in facilities. You find that patients come, these are medications they are taking on a daily basis. But you find that at sometimes they are stockouts. So that means that I will still urge the government officials, the parliamentarians, please, and also agencies like NMS, joint medical stores that are responsible for the supply chain of medicines in the country. Please, let's prioritize medicine for diabetic patients, because the fact is that these medications are expensive for majority of the Ugandans. They cannot afford it. That's why it brings me to a point of encouraging patients actually to join these patient health clubs. In areas where we have these patients clubs, they have actually worked. because in patient health clubs, you come together as patients. You know that, for example, you need to test, to screen your blood sugars on a daily basis. But when you go to these facilities, even the cheapest, they will demand you for 5,000 for a screening.
Which that you can't do on a daily basis.
Which you can't do on a daily basis. Yet the management demands that you should do your blood sugar on a daily basis. You get? So I advise patients to join patient health clubs. When you join these clubs, you come together as patients and you're in position to understand your problems. You're in position, actually when I was in Kalisizo, they would contribute money on a monthly basis.